This TED Talk is by Dr. Mark Davis, who specializes in gut health. He's an expert in fecal transplantation. FMT stands for fecal microbial transplantation. He uses this technique on patients that have ulcerative colitis, Crohn's, IBS, and MS, and how he does it is he takes the poop, does like a centrifuge technique where he gets concentrated amount of the bacteria, and he inserts it either via an enema or there's also a pill that patients can swallow. He has a 90% success rate with this procedure, and those patients with C. diff that use continued antibiotic treatments to treat the C. diff have a less favorable outcome. Part of what I also found interesting about his TED Talk was the things he does as a naturopathic doctor in order to help his patients. So it isn't that he doesn't prescribe antibiotics, but when he does prescribe them, he also prescribes probiotics. The probiotics are to help prevent C. diff. He prescribes DHEA with prednisone that can help treat insomnia and depression and bone loss that comes from taking the prednisone. He uses saffron and St. John's wort with the treatment for depression, and then he uses wormwood and vitamin E in order to treat IBS. This is a different approach to medicine that we often don't hear much about, but I think in the coming days we're going to hear more and more about natural approaches and using herbal and supplements and things in order to treat chronic inflammatory disorders and infections and different things that patients are struggling with, because I feel like there's less trust with pharmaceutical companies since 2020.